I feel more secure in myself and my own choices. Before, I felt very out of control, but now I feel comfortable saying no. My name is Erica Hall. My situation comprised of just being really frustrated and disheartened in all the attempts I had tried to make to get healthier, to figure out why I was so fatigued, figuring out why it was just difficult to do day-to-day things, lose weight, my nutrition, and I kept falling off every single plan that I had tried. And after working with traditional Western medicine doctors, everything was going to be a prescription. No one would take my concerns about my hormones or my quality of life seriously, besides just wanting to prescribe me something to make the symptoms go away without getting to the root cause. The fatigue was real. I would get through half the morning and just feel very sluggish, like I needed to nap all the time. I found myself hungry around the clock, but then nothing was really satiating me. I wanted to have the energy to go out and to work out, and I just wasn't able to drive up the motivation for it. I felt like I was having decision fatigue, whether it was taking care of my kids. I didn't really make the time to take care of myself, and I was just constantly stressed. I'm in graduate school, the mom life, the wife life. It was getting to the point to where one extra thing, like sticking on a meal plan, seemed like it was going to be an additional strain. I had actually been working with a mental health provider, seeing if medication could work for me and deciding I really wanted to give my body a chance to go forward in what it was designed to do, which is to heal and to feel good. I decided that I was going to invest in myself and maybe go a non-traditional route. My husband actually found her. He knew that we had actually chosen the functional medicine route for our son who has special needs, and he was thinking, hey, maybe this could be a great option for you as well. And he was on Google and was really looking for someone who would focus either on women's issues or had really good reviews and success rates with really listening to their clients. And he found her, and I reached out, and I stopped looking after our first meeting. I had tried some meal plan options just to see if maybe helping my nutrition would help. Of course, I had done the Western medicine side of things. It was treating the symptoms only. I was curious as to why I was feeling fatigued, because I felt like just treating the symptoms was more of a band-aid. I definitely wanted something that was really integrative, something that was going to look at me as a whole person. But I was really hoping for that face-to-face time, not the typical 5-minute in and out the door model that I have at my primary care, but someone who was going to work with me and have it be more collaborative. So after doing some research and actually meeting with her for the first time, it sounded like that's exactly what it was going to be. The doubt was more along my own ability to stick with the plan. It was going to be an investment. It's not something that insurance covers, but I knew that it could work if I would stick to it. Pretty all encompassing, which is really great. It's not just what the test results are saying, it's how I'm feeling about it, and really a lot of self-reported data as well. The communication that I get back from her is always timely and so thorough, knowing that she had her functional medicine training behind her as well as her medical degree, and all of her training, and then knowing what works for my body and hearing her listen to what either hasn't worked for me in the past or things that I can explore that's new. And I like that it's not just being told to me, it is a discussion and it is a conversation, and she values my input, which is something that I haven't experienced with any other provider before. It's such a partnership and it's such a collaboration that it really is uniquely tailored to you and what your body needs. And that's something that you're not going to find anywhere else. I feel like the traditional medical model is very much you fit the diagnosis code, you fit the book, here's the script, or they just tell you to do better, eat better, sleep better, exercise more, without telling you how or in a way that you can actually cause harm to yourself if you start an intense workout plan right away. So with the entire program that Karolina offers at her practice, you really feel as though you have a team with you to ask questions to. And I feel like that's empowering as opposed to just, that's just the way it is, take this to make it go away. She actually works with you to figure out how you can heal and really work to improve. I have increased energy. I am sleeping so much better. I am off all of the sleep aids and melatonin that I had been using ahead of time. Lab results have actually come back really well. I was deficient in certain vitamins, and now that those are back up to normal ranges, quality of life wise, I have more energy. My sex drive is back up. I'm exercising regularly. I've actually dropped 16 pounds and it's been sustained. I feel so much more satiated when I eat that now I've actually actually turned more to intuitive eating as opposed to just eating by a clock. So I feel like I have more control, not only over what I eat, but what I have energy to do. And my mental clarity has improved so much more. I'm not having the brain fog, and I don't feel like I have to struggle through the day without a nap. And that is a significant improvement, not only for my quality of life, but for my interactions with my family as well. Where it's meant for me is I feel more secure in myself and my own choices. Before I felt very out of control, but now I feel comfortable saying no. I literally used to drive around thinking about what I was going to eat, where I was going to stop for food, and I don't have that anymore. And it was almost, I don't want to say addiction, but it was. I was very dependent on that sweet to not only regulate my mood, but I thought I needed it for energy, and it's not. I just really needed real food and those real supplements and those nutritional elements that I was missing drastically, not only from my diet, but from my ability to function normally. It kind of just reinvigorated that drive to want to continue because it was working. So it's almost like success breeds more success. I would do it for my kids. I would absolutely, if they needed to be healthy or if there was something out there that can improve their quality of life, I'd do it for them in a heartbeat. I wasn't willing to initially do it for myself, but by investing in myself and just who you are as a person, whatever capacity you are in life, as a family member, as a coworker, you're worth it. So being able to invest that little bit upfront for lifetime change ramifications going forward, you're worth the investment, and you can be that for other people, but you should be that for yourself as well.